Great. Good morning, everyone, and welcome. Stories from the Frontlines Public Health. Before we get started, I want to mention a couple of things. Feel free to share your video. I know we have a small group with us today, but we'd love to see you. Also, feel free to come off of mute whenever you have a question. You can also, if you don't feel like doing that, just type it into the chat function. I will go ahead and relay any questions that you have at all. We will have a recording of this. We'll be following up by email with that, so keep an eye out for it. And we're going to have our representatives here today introduce themselves. But first, Amber, did you want me to go and pass it to you first then?
Thanks,
Or...
Nick. I appreciate
Okay.
it. Yeah, that's great. So good morning, everyone. I'm Amber Cote. I'm the Director of Education and Service Enterprise for Colorado Nonprofit Association. And I am thrilled to have this time with you all, especially in the busiest time of the year in every single way, I'm sure, especially for the four of you. So as I was saying earlier before we started recording, I am deeply grateful for you being able to make time to talk with us today and share with the nonprofit sector what's happening for you and those that you serve on the front lines. I'm just going to say a few words about this series and then we'll get started with your introductions, and then I have questions for you all. And then the few folks that are here with us in our audience are also welcome to ask questions today. You are lucky in that you've got, I think you'll have some to ask direct questions to the people that are here with us today. So we are doing the Stories from the Frontlines. We started it in October of 2020. Obviously, this has been a year like no one has ever seen before. And we have wanted to really start real life to what people are experiencing out in the world, who is specifically related to our... So my internet connection is spotty, Nick. Is that what you're saying?
Just a tad. You're coming in okay, but yeah, it's up to you. Video off might help too, but right now it's sounding okay.
Okay. Let me know if it gets over challenging and I'll turn my video off. We wanted to hear authentic stories from people who are out there on the front lines, the people that they work with, and then you directly, so that we can have a face to some of the stats that we're hearing about, especially those of us in the nonprofit sector. So we started with early childhood education. Then last month we talked about food insecurity, and this month we're talking about public health. And I can promise you that in 2021, we will be circling back to public health several times just to keep checking in and seeing how things are developing. Obviously, this is a really big time. The vaccines just started in Colorado yesterday, is my understanding. That doesn't mean that all of you are being directly impacted by that, but it's certainly another factor that we are all excited about, apprehensive about, and we look forward to hearing from you all. So with that, I'm going to ask each of you to introduce yourselves, and I'll start with the person who's next to me, Haley.
Good morning. Thank you for having me. My name is Haley Zachary. I am the lead communicable disease epidemiologist at El Paso County Public Health. And in the realm of COVID, I am responsible for our partnership with our schools and our daycares. So we're working really strongly with those partners, ensuring that kids can get back in school and do it safely.
Thank you so much. Thank you for being here. Tom, can you introduce yourself and talk about the organization you're with and the role that you play there?
Certainly. My name is Tom Dueber. Thank you too for having me today. I'm with Boulder Community Health, and we serve the greater Boulder community, Boulder area. We've got clinics, Boulder County area, excuse me. We have clinics out in Lafayette and Erie and Boulder, and then of course the main hospital here as well. And I'm the manager of volunteer services.
Thank you, Tom. And that's a newer position for you, isn't it?
It is, yeah. I started, that's a little bit of my frontline story. I started in this position about 3 months ago. There wasn't, volunteer services has changed completely. We don't really have volunteers in the hospital. We've now become responsible for the COVID screening. And I was actually redeployed. We can get into this later, but I was redeployed from a marketing position to a COVID screener. They eliminated my position. And so I did that for several months before I was able to apply for this position and then become the volunteer services manager. So now it's not only dealing with the screening process and some of the things that very limited things volunteers are doing now, but then trying to figure out what volunteerism looks like in a hospital as things start to, I mean, normal is not the right word, but start to head towards some level of normal.
Thank you so much, Tom. I look forward to hearing more about your story. Kaylee Ann?
Yeah, Callie Ann. Hi there.
Callie, thank you.
Thank you for having me, everyone. Good morning. I am a nurse, and I have been a nurse for about 12 years. I've worked in both rural and urban settings and specialize in cardiac units and also home health, and have a special passion for home health care.
And what region are you in? You're all over the state, aren't you?
I am. So I live in Pagosa Springs now, down here in the San Juan Mountain region in the Four Corners area. And I work and cover the whole state in my position at the Colorado Center for Nursing Excellence. I'm also a affiliate faculty and clinical scholar for Regis University and teach undergraduate nursing students in both hospitals and home health settings. And I'm a volunteer on the contact tracing team for the San Juan Basin Public Health Department. And in my position at the Colorado Center for Nursing Excellence, I'm a project director and an executive leadership coach there. So the Center for Nursing Excellence is a nonprofit, and we are the workforce center for the state of Colorado. And all of our grants and programs that we have work to strengthen and support the workforce pipeline in some way. So there, my responsibilities include leading the Nurses on Boards Coalition, which is a national movement to get 10,000 nurses on boards of directors. Nurses have a really unique and valuable perspective and should be at the table, every table where health and the business of healthcare is being discussed. I also lead a program called the Nursing Leadership Connection, NLC. That is a personal and professional development program for nurse leaders of all ages and levels. And we hold various events for that. And then I also manage over 40 nurse practitioners throughout the state who we're supporting through a grant to return to school to get their mental health certificate to increase behavioral health access in rural Colorado specifically. And so, yeah, I do live in Pagosa and do all of that from Pagosa.
I don't even know how you had time to come on at all. That is so many things that you represent. Can I ask a clarifying question before we move on? When you talk about getting nurses on boards, do you mean any kind of board, or is there a specific kind of board that you're looking for nurses to serve on?
That's a great question. It is any kind of board. Definitely where health and healthcare is being discussed, but any kind of board. Nurses really have this perspective, public health wise and otherwise, just how we're trained to think long-term, holistically, community impact, that type of thing. We're really valuable to have on every board. So school boards, all over the place. Yeah, any board.
That's an intersection of what we do.
Really?
We do training for anyone in the communities across Colorado who are interested in serving on boards, and then really try to help them think through the most strategic way to serve. So maybe we can talk offline and see how we might be able to work together.
I would love that. Yes.
Wonderful. Thank you so much for being here.
Thank you.
Stephanie, can you introduce yourself, talk about your role and where you're at in Colorado?
Sure. So I'm Stephanie Sayers. I'm a family medicine physician. I work at Marillac Health, which is out here in Grand Junction. So we have 2 clinic sites out here in town, and we are a federally qualified health center. So we see a majority of our patients are underserved, uninsured patients. And last year, I think we served about 12,000 patients. And so I'm the medical director at the site. So in addition to seeing patients, I work on projects, quality, working on team-based care, supervision, and those kinds of things.
Thank you so much for being here. Just listening to all of your roles and everything that you're working on, I'm just profoundly grateful for any amount of time that you could give to us today to share your story. Thank you all very much for being here. So my first question, and I'm just going to go in the order that we started introductions, if that helps you all know who next. My very first question really, and this is really centering us all in you as human beings. How are you doing, and how has this year affected your life? And we'll start with Haley and move forward.
Just going to turn my video off when you call on me. I love going first. That's a really great question. And to be quite honest, I feel like I'm pretty lucky in terms of when this pandemic came. I don't have any kids. My family doesn't live here. And therefore that kind of allowed me to become a robot and, really kind of lean into my work and fully dedicate myself to the work in the pandemic. And so, honestly, I kind of think that's a bit of a blessing in disguise, because I cannot imagine having to work from home with kids at home and having to take care of them at the same time as taking care of myself. So it's been really difficult, really long hours, but I'm also very lucky in that I love what I do and I find it absolutely fascinating every day. So although it's still work, it's really been a pleasure to get to know a lot of our community partners and even my coworkers, and really kind of, work through this together in partnership with them.
Tom, how about you?
All things considered, doing okay. I think part of it for me is that it helps being part of the solution and having access to reliable information. I think both of those things are huge for my mental health. As I had talked about before, my position was actually a casualty of the COVID crisis, the COVID pandemic. And so I got redeployed into the screening position and then N95 mass processing for several months. And it really made me rethink about what I wanted my career path to be and what I wanted to do. And when the manager of volunteer services position opened up, I looked at that and said, it's a great opportunity to take a different path, reinvent myself a little bit. I mean, the world's going to change forever, so why not me as well? And so, there've been some uncomfortable months, but I'm really, really excited, if that's the right word, appreciative that I get to be part of the solution.
Thank you so much. And as Haley was talking about her not having family or kids in her home that she has to manage working from home, what are some of the challenges that you've been up against, Tom, just personally, as it pertains to like the work that you've been doing?
Yeah, no, I don't have any kids at home either, which helps out. However, I'm also a competitive girls soccer coach. And so trying to figure out how to make that work this spring was probably even more challenging in some respects, certainly mentally, than the work aspect of it. We tried to provide as normal a soccer season for these girls as we could, trying to give them that one piece of normalcy that they just didn't have. And every day we stepped out there was a different rule that we had to follow. Maybe we were wearing masks, maybe the girls were, maybe the girls weren't. Maybe you could allow fans at a particular game, maybe you couldn't. We played a couple games where there wasn't a parent to be found. If you can imagine trying to manage a bunch of middle school girls knowing their parents are 20 miles away, so there were a lot. To me, that was the real challenging part, was trying to stay focused on work and do all the things I needed, but then really do that thing that I'm passionate about in that coaching and helping them, again, find that normal piece that they, talking to the parents and the kids after the season. We got full seasons in. We played all of our games. We traveled. We went up to Steamboat for a game. I mean, it was, to try and do that in a pandemic with a bunch of kids was not easy, but I think it was worth it. And I think it was really important for their mental health, and even probably mine a little bit, to have that level of normal.
Thank you. And Haley, I don't think I said thank you, but thank you. Callie.
Oh, okay.
Kellyanne.
Yeah, I didn't know if I forgot my order.
It's
I should just
no
jump in.
worries.
I'm like still thinking about when I was playing soccer and how crazy those bus rides were and stuff. Yeah, so through some of the work that we've done at the center and just having nurses who, nurses kind of always have to be fine when you're at work, and so it really rolls off our tongue quite easily, like I'm fine. And so we have made a commitment to not say that we're fine. Excuse me, my throat this morning. And so we really have to come up with like 2 or 3 or 4 other words of how you're actually doing when we ask each other that. So I would say this morning I am I am really grateful for sure for a lot of things. I feel mentally strained also, and very empathetic and gritty and resilient is really how I'm doing this morning. I think that, we're all in the same storm, but in different boats with this. And in many ways, my boat is really nice. It's not a yacht, but it's really nice, and much better than simply a life jacket and getting waves crashed on me every single day. So feel really grateful for that. And most of all, because I don't work in a hospital, I think is what that comes down to, that my boat is automatically quite a bit nicer than some. Given that, I have done as much and different kind of grieving of everything that has been lost over this year. Personally, routine, all of those types of things. I feel like we're all in some type of stage of grief, and I'm in acceptance in a lot of it and finding meaning in a lot of it as well. So grateful for that. Excuse me. Let me just take a drink real quick. I'm also 8.5 months pregnant right now. So, having my first child and a newborn and having no one experiencing it with me besides my partner, which has been one of the really special things and will be when this baby comes, is different, and it might be my only child. So not having family or friends close by or able to visit and experience and witness the whole thing has been really interesting. I don't necessarily know any different, but I can see how it's quite different to have a pandemic baby than to not. So personally, that's probably the biggest element of the last couple of months and the next future couple of months, that I'll be experiencing that in different ways.
Wow. I didn't even know that. Congratulations. And thank you. Thank you so much for sharing your words. I so appreciate that. Our staff this year has really been working on just being really authentic and as vulnerable with one another as possible, building trust through those sharing of how we really are doing. So I really appreciate you making it policy, essentially, or practice to use words that ground you in not I'm fine, because I'm sure nurses are so strong and expected to be persistently strong, that when you are asked, especially by a peer who knows that you're probably not fine all the time, for you to expect that of one another is really powerful. Thank you.
Thank you.
Stephanie. So we're hanging in there. My motto is just take it one day at a time. Our situation's a little unique. I had twins on April 6th. So right as our initial peak, our first peak was surging. And so that was an interesting experience. Just having them, and kind of like you were saying, Callie, not really having any help. We had we also have a almost 3-year-old at home too. So trying to navigate the pandemic and trying to keep everybody healthy was difficult, but we've made it through, and fortunately did get to see grandparents here and there, but now we've separated again just because we're surging again. And so that's been tough on everybody, but we're just hanging in there. And like I said, one day at a time. Fortunately, my husband's a stay-at-home dad, so that has been really fortunate for me, at least, not having to try to figure out the complexities of daycare and those risks associated with that. I am usually a very like germ aware person, and so even before the pandemic, like flu season, I was wearing a mask when I was pregnant every day just to be safe. And so with the pandemic now, it's not much different, you know, wearing a couple masks and the face shield and trying to navigate what is safe to, like, you know, when you come home, do you shower? Do you wash your clothes? Like, what is this new routine? How is this affecting me? Am I going to bring something home? Is today the day I'm going to catch it? Those kinds of things. But, you know, we're making it and slowly making it through. And like you had mentioned, the vaccine is in town and I'm scheduled to get mine on next Tuesday. So hopefully this will start to, hopefully we'll start to see the light at the end of the tunnel, or at least a little bit more normalcy, whatever that might look like after this.
Wow. Just asking the four of you, how are you? Is just like, it's immediate sort of gets us to that place, right? Of like, these are the front lines. Haley's life became completely consumed by her work, and Tom's balancing new work and a new calling, which I actually am really, I'm really excited about, because I think that you're also a great asset to the volunteer engagement aspect of the world, which I have a big heart for. Callie Ann and Stephanie, being new moms in the midst of everything else that is swirling around. It's just, it's really powerful to hear your stories. And we're only one question in. So our next question is, what unique challenges, can you share with us some of the unique challenges your organizations and the people you serve have faced this year through the lens of public health? And I know some of these questions are like obvious. So if you could just go a little deeper into like what it is that like El Paso County Health has been, some of the things that you've been working with, specifically Haley with kids, and some of those unique challenges that you've been navigating.
That's a very difficult question. I mean, it's really hard to kind of, let's put it this way. I don't think I have a lot of perspective right now. I'm probably going to look back and be like, oh, a lot of those things make sense, and here's the timeline. But right now, it's all just one giant mess. Like the whole last year has just been like, it took forever, and at the same time, it took a day. So there's definitely been a lot of challenges, and they're ever evolving. I think, you know, the biggest one is probably establishing that new normal. You know, how do we, you know, tell people that they need to normalize mask wearing and social distancing and find new ways to celebrate the holidays without their families, you know, to protect them. You know, it's really difficult telling my parents, you know, I'm not coming home for Christmas because I can't forgive myself if I get you sick. It's, you know, it's trying to get people to understand that there are repercussions to our actions. And by every individual taking responsibility for their actions is the only way that we're going to be able to, you know, stop this virus from spreading before we have a vaccine that's widespread. And so really trying to reach every individual, but every individual on different levels, you know, be it personally or professionally, working with individual people and working with businesses and working with schools, and, you know, trying to get people to understand that we're not trying, this isn't punitive. We're not trying to, you know, get them in trouble. We're not trying to, have negative effects on their businesses and their livelihoods. We're trying to protect the health and safety of our community. And it's really kind of funny because I feel like public health does this on a very quiet level, in all areas of communicable diseases. But it's only when something goes wrong that people hear from us. And so, these are practices that we've been talking about, that we've been implementing for decades prior to this pandemic, but people are just hearing about them now. And so really trying to combat a lot of that false information and that misinformation that's perpetuating the community, and getting people to the right information that is scientifically based and sound. And it's very difficult, because essentially this is a new virus. There's a lot that we don't know. And sometimes that's the best answer, is this is a new virus and we're still trying to figure things out, and trying to get people to understand that public health is just people too. Scientists are just people, doctors are just people, and we're all in this together, and we all have to find a way to move forward together. So really meeting people on that one-on-one and trying to get them to understand, the things that we know and the things that we don't.
Callie, can I ask you a quick question before we ask Tom the same questions? When you're working with children and families, like what are some of the things that you've had to do specifically, and I'm assuming there's some challenges with just the spectrum of where parents are at with their kid, protecting themselves and their children, and how they enact that behavior out in the world. Like, what are some of the things when you're trying to talk to families about how to stay safe?
So I think, one of the things that we really come up against a lot is that, keeping kids safe by protecting them from COVID and putting them in quarantine, that's one positive benefit, but there's a lot of cons that come along with that. Children who are at a very important point in learning how to read, or learning how to socialize and have human interaction, those really important fundamental things to our core are being missed out on. And so, although I think a lot of parents understand, the risks of COVID, I think they are prioritizing the other risks as well, and the other cons of that. And so I think for parents, it's really important to let them know that schools don't exist in a vacuum. That's something that we hear a lot about, is that kids don't have severe illness. And for the most part, that's true. But, our teachers may be immunocompromised. Kids have grandparents, kids have parents. There are immunocompromised kids who may have more severe illness, and trying to get them to understand that, again, we are all interconnected in this web, and that although, it might be difficult for your individual healthy child to quarantine, this could be protecting a parent, another child, or, another person's loved ones, and really trying to bring it home that it's not, an individual thing. It really is a community thing, and we all have to, unfortunately make sacrifices, but at the same time, find new ways to move forward together. So really trying to get them to understand that it's a multi-dimensional approach. It's not a singular kind of, you're in, you're out. Here's your choice.
Thank you. That's such an important, the interconnectedness has never been, I think, more clear than it has been this year, or when there is a lack of that understanding, like the ramifications and ripple effect of how many people can get hurt when other people don't understand that we're all connected. Tom.
Yeah, there are a lot of challenges. Working directly in the hospital is a challenge in and of its own right. But one of the things that we are faced with every day is finding that balance between keeping our staff and our patients safe versus the mental health aspect of allowing visitors in to see patients, or getting the outpatient services taken care of for labs and imaging, and getting surgeries done for all those people, so they're not in pain and at home, and not putting those things off or not getting the proper diagnosis. And so it's finding that balance. And you know, we've got a department, well, within our department, we've got a job function that it didn't exist 9 months ago. And so we're trying to train staff and make changes on the fly, and really trying to accommodate as our leadership is making those decisions, you know, the safety versus the health of the patients and the staff. And so that's a real challenge, and it can change every day. It's you know, okay, today our visiting hours are going to be from 12 to 4. Okay, so we'll set up and we'll change our staffing so it's 12 to 4. Well, we're going to open up to for one person to accompany for the last. It sounds trivial, and we get that a lot. Well, this is pretty trivial, but it's not. We see between 400 and 600 people a day through the main entrance of this hospital. And so, that doesn't include companions and helpers and guests. That's patients. That's outpatient. Well, it's outpatient and visitors to rooms. And so, you know, if we go one way or the other, 5 or 10%, it's a significant number of people. So that to me is the real challenge, is getting our staff to the point where we can accommodate these changes each day. And then the other thing is that Boulder is a very diverse community. And so we have different people, different personalities coming through every day. So we've got the group of people who are very safe and very cautious, maybe almost to a fault. We've got people who, for whatever reason, at least 2 or 3 times a day, will not allow us to take their temperature from their forehead. And so we've got that mental toll that it takes on our staff to work with those different personalities each day. And again, that education part of, you know, understand, look, this is safe, this is proper. I know that you want to go up and you want to see your loved ones, and we know that 3 or 4 people want to go up there, but we just can't do that. And the education on the fly that we work with there. So again, it's an important job that I think that even our own staff kind of takes for granted. You know, yes, we get that you have to screen, but it's especially with, you know, we're hiring people. I'm hiring people constantly. I'm trying to build up this staff, or we're redeploying from different areas of the hospital. So I've got the personalities among my staff are very different as well. So, you know, and there are, of course, many, many challenges at the hospital, and that's not my area, and I'm not going to get into that. I'm not going to speak to the challenges that our leadership and our medical staff are going through, but those are the challenges we see in our group.
Thanks, Tom. It's so interesting, though, just that you point out the like even just changing the hours daily. Like some people, I think, as you were saying, would think like that's not a big deal, but when you're talking about huge numbers of people and the people who are like staffing and working with those people, like every time you make a change, it's probably a big upheaval of things you have to coordinate and move around.
It is, and I think the other aspect is you've got the husband who came in on Tuesday to see his wife at 9 o'clock, and then he comes in on Wednesday at 9:30, but visiting hours have been moved to 11, and he's not happy. Understandably, he's not happy, and so now you've got a fight on your hands at the main lobby of the hospital, and you've got you've got to get different people involved. God forbid you've got to involve security, which we have. But that's just, I mean, I understand why he's upset. There's just unfortunately nothing we can do. And people aren't walking into the hospital in a great place right now anyway. It's just people are in a bad place, and we get it. Those are challenges. Those are definite challenges, being right out there dealing with 400 and 500 people a day, some of which really don't want to be there.
Tom. Callie Ann?
Yeah, I have the benefit and the privilege of working with both the service clinical side and education side of nursing, in both my positions and also my position at the center. So the center is a neutral convener in a lot of ways, where we can have people come together who are in other worlds competitors, but when we bring them together, we are just all neutrally convening and collaborating. So that's really cool. As far as the service side, public health is not just the health department at all, but we train every nurse in the foundations of public health when they're in school, because every patient is an opportunity to educate and serve in that way. So when Haley was talking about, the public health, it's kind of like the ironic part of public health is that if you over prepare, people are upset. If you under prepare, people are upset. And what we do best is prepare and hurry up and wait and prepare. That's what we do. And when it happens, people are really thrown off. But it's happening every single day behind the scenes so much. So, as far as the front lines of nursing, I think the biggest thing challenged is just the morally distressing decisions that they're having to make each and every day, all throughout the day. Anything from caring for patients and they don't necessarily feel safe, especially in the beginning when we didn't have the proper PPE, but we knew what kind of PPE we needed based on the small amount of information that we had, and policies and protocols were changing hourly, and you just have to accept and believe and continue to go because your patient needs you to go in there into their room and serve them. With that, you have to make the morally distressing decision to put yourself at risk, put your family at risk at home for this person that you don't know, but this is your passion and your job, and having to make that decision multiple times a day is just exhausting morally. Also keeping family, saying no to family to be with their dying family member. I mean, just imagine being that person that has to hold the iPad up while everyone is crying in the room, and you would want to be there with your family, but you're having to tell them no. That moral decision is so hard for nurses to make. So just having these really intense and exhausting 13+ hour shifts where you have an N95 on and a face shield on and a bunny suit on potentially the entire time. For sure your N95, which is harder to wear than a cloth mask, and you finally exit the doors of the hospital only to see people upset that they're being asked to wear a cloth mask for 30 minutes when they walk in the grocery store, or deny the severity of the virus and its effects when you just lived it for so many hours that day, and you have to come back and live it the very next day. Just what the toll that takes can cause moral injury, which is this enough moral distress can cause moral injury, which has some serious effects. So, people were howling in the beginning at 7 and 8 o'clock when nurses were getting off shift and going on shift, and just showing that support of, we know that you're going into the trenches, into that building for this entire night or this entire day, and we support you and we're standing in solidarity with you. And that doesn't happen anymore because you can only do that for so long without it being straight in your face that it's still happening. But not much has changed inside a lot of hospitals, healthcare facilities since March. If there has been a lull, what they're doing is trying to go back through all the policies and protocols that they've created and solidify some of those, but all the while knowing that winter was coming. So not being able to truly relax until, herd immunity is on the horizon, which just in the last couple of days, we at least have a potential horizon for that in front of us. So the light is there, and the support still needs to be there too. The burnout of nurses prior to the pandemic is very real. Nurses, doctors, healthcare teams, frontlines, everybody on the front lines. It's very, very real prior to the pandemic. And now, it's critical. And our workforce pipeline is more at risk than ever. We have potential for nursing shortages in some areas, not necessarily urban areas, but we knew that was coming, and that's not even with the pandemic included. And so as far as workforce future, it's critical at this point. I'm on the board of directors for the Colorado Organization of Nurse Leaders, and many of my peers there are, the chief nursing officers and those types of things from hospitals around the state, and just hearing, they're in incident command meetings 5A and 5P 7 days a week. They're still doing it. And so on the school side, that's a very different challenges as well, because nurses get hundreds and hundreds of hours, just similar to what Haley was talking about. They learn to socialize properly with the patient, how to touch the patient. You can learn skills all day long, but you need to be in these facilities, all different settings, public health, long-term care, mental health, acute care, and learning those socialization skills. And how do you balance that? We need to get them 700 hours in their schooling time before they can graduate. And again, these are the people who are going to be filling those pipeline workforce gaps next year, for instance. And you have to decide, what is the safety of the student? Do we have enough PPE for them? What areas can they not go in because we need to save the PPE for the healthcare teams that are employed? So the shift that those schools all over the state have had to make with simulation, really quality virtual simulation, skills lab, still just trying to bridge that gap that we know that in the hospitals and the settings would be best, but we have to make something happen because we can't afford to not have hundreds of nurses graduate next year to backfill the retirements that are happening, but also the burnouts that are going to happen after this pandemic. There's going to be some people that are just going to say, I'm going to retire, or I need to move on or get out of clinical. So we need to keep that in mind, that both the service and the education side of nursing is having to shuffle so much with our eye on the long term and the support that they need, just the cheerleading that they need to keep going.
Thank you so much. I don't think that I prepared you all with this question specifically, but like as we go back through, I have 1,000 questions that I know we don't have time for, but I'm things that keeps me up at night is all the folks that are on the front lines. Like everybody's just holding it together to keep everybody alive, like we're in a war zone. And when that horizon really becomes clear, like how are we going to care for all the people who've been caring for all the people, in this time? You all, if you have some thoughts about how can the rest of us care for those who've been caring for us? Stephanie.
So we've come up with some challenges during this time. A big one that we're trying to navigate is incorporating telehealth into our clinic. And so right before I went on maternity leave, I was helping get our clinic kind of on board with telemedicine. That was in like the end of March. And so initially it was like trialing a little stuff here and there. And during that time, over the past several months, we have had to try several different platforms. Our broadband in the county isn't great. And so we tried using our electronic medical record system, has a video component, but that was just kind of a disaster with trying to get, our staff trying to figure it out, the patients, and then trying the connectivity was difficult too. And so that's been a challenge, just trying to incorporate that, figure out payment for that, because that seems to be changing all the time. Medicaid, Medicare, private insurance, reimbursements has been changing. So obviously trying to see as many people with telehealth as we can that's appropriate. Trying to educate patients that there are some visits that are okay for telehealth and they don't have to come in if they're uncomfortable doing so. So that's been one thing that we're just trying to figure out, 1 week at a time, trying to see how's this working, how's that going. Tom had mentioned too, we're having a lot of patients with the screening process and not wanting their temperatures taken or not wanting to wear a mask. We've had a couple patients charge past our screening desk at the front, and we've had to call security on them, and just trying to, there's always the patients that think this is a conspiracy, a political thing, or that it's not that bad. I don't want to wear a mask. So those are challenges too. Just, I feel like every maybe 25 times a day, I'm saying, please put your mask on the right way. Please cover your nose. Please stop taking your mask off. Please stop blowing your nose in front of me. You know, like those kinds of things. Another thing too regarding the screening is people are lying now to get in. So they will say, no, I don't have a fever. I've not been, you know, they'll just straight up lie. And then you'll get in the room and I'll hear them coughing. And I'm like, okay, well, that doesn't sound like their normal COPD cough or something like that. And you'll go in and they're like, oh, well, I didn't want to wait to get tested, so I was hoping you could test me today. Or they'll lie about not having a pending COVID test. And then they'll call the next day and say, oh, by the way, my COVID test was positive. Sorry, I saw you yesterday. So now then that triggers that whole, like, now you've been exposed, you know, we're still working and just monitoring symptoms, but it's just, it seems like that's happening more frequently. So that's getting frustrating. And, you know, fortunately our staff is really good at wearing masks and is really well protected from that standpoint, but you just can't assume everybody's telling the truth. And then another challenge. So we see a lot of the assisted living, nursing home, and homeless population, and we're having a ton of outbreaks with that population right now. So a lot of our SNFs and living facilities are having these outbreaks, and it's trying to figure out how do we still care for these patients, and, you know, without bringing them in and creating this giant outbreak in the community. And so fortunately, some of them are starting to get over. I know we've had, according to our public health website, some of the places had over 100 residents with symptoms, and we've had some deaths from that. So trying to figure out what's a safe way to still care for these patients without exposing everybody and getting more people sick. And then just the little stuff like trying to figure out how to make the lobby safe. You know, now that it's cold out, people can't really sit outside and waiting in their car. So trying to adapt to those like distancing guidelines while not upsetting our patients, because some of them just are like, well, I'm not gonna wait around or wait in my car or, you know, do all these things. So some of them will just leave and not even be seen. So just trying to keep everybody happy and trying to screen everybody and see, you know, every week what's going to be coming at us this week, what's going on. But I mean, those are just some of the challenges that we've seen so far.
I can't even, I mean, I'm just thinking like when I don't know if you got a chance to look at these questions before when I sent them. But I'm just thinking you were probably like, I don't know what comes to mind right at this second, because there's so many. I'm sure that like, how do you even summarize it all? Like you did just so beautifully, but like you said, I'm just sure there's so many, you can't really capture them all. Thank you, Stephanie. Mm-hmm. Okay. So I know that you've actually started covering this in your answers already, but if there's anything else you'd like to share about unique adaptations and changes that your organization has taken in this time, and maybe even some of the things that are things that have actually been like unexpected advantages that you'll see adapting and keeping as whatever the next normal is. Maybe just some things that are unique to your position in the organization that you see are either working, or maybe you tried it and you're like, oh, I'll share with everyone that this doesn't work. Whatever you'd like. Haley?
So we're government, so we pretty much, you know, have the standard work week and you work from the office and everyone does the same thing. And so, you know, the pandemic has really allowed the public health department to really kind of open up and be aware of some of those changes and some of them working. So we went remote in terms of being able to work from home fairly early on, which was a really difficult change for me. I think I need a lot of routine, so being a government employee works for me. But, you know, waking up at a certain time, going into the office, and then coming home at a certain time on particular days was something that was really difficult for me to overcome from working from home. And so now that I work from home, I don't know if I could ever go back into the office. Wearing my pajamas all day certainly has its advantages. But there's some really strong disadvantages to that as well, such as my kitchen is 10 feet away and I don't move more than like 300 feet in a given day. So that's been really, really difficult. But at the same time, knowing that I don't necessarily need to work from 7:30 to 5 every day, knowing that I can be more productive working from home and maybe working different hours. So even working in the evenings, I can accomplish so much more because nobody else is working, which means that, you can kind of hunker down and get some of those data related tasks done or some of those emails off of your plate that you just don't have time for during the day. And I think that's really kind of shown through with not only, individuals, but also, towards our leadership and our higher levels, is that, we can often be very effective when working from home and in a lot of cases, a lot more productive than we were in the office. And so I hope that they are, willing to retain some of that. I think it's going to be really difficult trying to even get back into the office now that we've increased our staff so much, before we have, everyone vaccinated and before the virus, levels are really low. We're going to deal with how we're going to have everyone in one spot while maintaining, social distancing and all of those other factors. So I don't even think, being able to get everyone back in the office is going to be something that we can do in the near future. But I'm not sure I'm 100% on board with getting back into the office either. So I'm okay with that. That's definitely the biggest one, is working from home, which has its pros and cons, just like everything else, but I'm in favor.
Thank you, Haley. I am too, actually. Tom.
Yeah, I think there are a lot of systems that, within Boulder Community Health and the hospital itself that are going to stay on forever. It's probably not, that's not, the clinical areas are really not my area, but I suspect you'll see some of those. What I'm finding certainly, is that hospitals were not, in the last 15, 20 years, not built to be secure facilities. Quite the contrary. They are open and everybody comes through and friendly. And I think friendly is good, but I think you're going to find that it's going to take it's going to turn back a little bit to a little less open, a little less let everybody through. I don't know that we'll ever get away from screening. I don't know. I think a lot of it's going to have to do with the effectiveness, the long-term effectiveness of the vaccine and that type of thing. Or is this something more like the flu that we're going to have to do every year because it only lasts, 3 months or whatever it is. So I think you could see, some long-term, some changes with that flow control through the hospital. And ultimately that might be a good thing. It might be good that we're not just allowing anybody and everybody to go through it all the time. We definitely need to open back up and allow families to visit their loved ones and what have you, but as we can. But that's really the only thing I see within my group, certainly, that would remain on long-term. I guess the other advantage we're finding, and it's something we might try and do, is, to Haley's point, working from home is actually reasonably productive. So for our volunteer staff, how do we continue to look for ways for them to be productive? Do we really need them in the hospital? Do we need to build out spaces for our volunteers within the hospital? As far, a lot of our staff is doing, making packets and educational material and that type of thing. That's all stuff that can be done off-site. So can we get that information to them? They're more efficient that way, and we don't need to bring them back into the hospital and create those spaces for them. So that might be something long-term too that you see is a better mix between on-site volunteers and off-site volunteers.
Thank you, Tom. I really appreciate that insight. And we were talking about that at the roundtable the other day, that this might be something that people in nonprofits can, in general, benefit from, really thinking creatively about people volunteering from home and still getting a lot of work done to help our mission without having a lot of bodies on site. Thank you. Callie Ann.
So to your point of how do we support the front lines, the providers, the NPs, the docs, PAs, nurses, CNAs, everybody on the front lines. We do a lot of that at the center, but we actually created a special program called the Ripple Effect because it does touch so many people in so many different ways. And that program is open to all healthcare workers. And it consists of learning sessions taught by our experts on moral distress, compassion, fatigue, growth mindset, honoring grief and loss, resiliency, self-care, those types of things. It also has support groups, support sessions with our licensed social worker that we have, and also professional coaching included in that. So we offer that through the Center for Nursing Excellence, and also we're in talks with hospital systems and different agencies to bring that program to them as well, and are always looking for grant support to support that. The other thing that we've been doing for many years is diversity, equity, and inclusion work. We have a number of federal grants around that. And, this pandemic has again brought to light the inequities with the outcomes of what race and ethnicity you are. So we've had increased participation in a lot of our programs with that. We have a program called Bias Busters, and not only nursing agencies are looking toward that, but police agencies, city, all different kinds of people. So that's a really good program that has increased participation, which is good. And we also do a lot of consulting to increase diversity and equity in both clinical and education settings. So we just have seen a lot more participation in that, which is great. As far as the Nursing Leadership Connection Group, NLC, we have also tackled racism in nursing, the history of it, how it affects how we learn, our textbooks, those types of things, and really understanding what racial lens we are looking through and our implicit biases ourselves, because it truly affects how patients are treated. And it's coming to light again as it does, and we need to just never forget that and never stop working on that. So we've taken a different angle and really hit that hard this year while it's on the forefront of everyone's minds. And we've moved everything that we're doing to virtual offerings. Generally, I travel to Denver. We have a giant classroom. We do all of our programs there. And so everything has been virtual, and we haven't slowed down one single bit this year. So learning how to do virtual platforms and making that just as interactive as an in-person event is certainly a talent and a challenge, and we're tackling that to keep that going. So through NLC, we continue to network and educate when people can come to vent and learn and empower themselves to just return to work the very next day might be the goal. And we've had over almost 250 nurses participate in NLC events just this year alone. And one of the challenges is with the ripple effect, we have this wonderful program, and when we are trying to get people to sign up for it, they're in such overwhelm that they can't even bring themselves to sign up to work on themselves because they just need to rest when it is their day off, or we certainly can't do it during a work day because when they're on the clock in some way. So that's a big challenge, is just getting people they recognize that they need the help and the support, but they're in just a place that they can't even consider it. So we're going to continue to offer that program, and participation went up during the summer when it was a bit of a lull. And then we're going to start it again in the spring, and we're just going to keep offering it because we know that you need it out there, and we're going to be here for you when you're ready and able to do that. And then on the school side, we got a simulation waiver from the governor a while ago that could just enable us to continue to educate the nurses so they could get through school. And so that's been helpful in keeping students safe, and also just a big challenge with knowing that everyone is fully prepared to hit the ground And nursing is quite different than, say, MD/DO school. You have a residency after you graduate. And with nursing, you graduate and then you're a nurse. And so we have to always remember that transition to practice is what we call it, where you need more than 6 weeks of orientation. You know, you need more like a couple of years of having somebody as a mentor or under somebody's wing to be like that. So knowing and understanding what support these nurses who are in school this year are going to need different, which is already a challenge, and they're pushed to hit the ground running the second they get out of school. Is it's not a safe way to practice. So we need to think about future how to support them differently than other new graduate nurses.
Callie Ann, can you share, is the Ripple program on your website? Is that how people can access it? Can you just share that really quick verbally?
I can, yeah. It's www.coloradonursingcenter.org. And it's under our events page. And at the bottom of our homepage, you can sign up for our newsletter, which would be great because that'll have all the offerings that you can see and forward to all of your networks for healthcare. So coloradonursingcenter.org. And I'll put it in the chat too.
Wonderful. Thank you. Stephanie.
Our clinic has made a couple different adjustments and changes in protocols with everything that's going on. So I had mentioned the telehealth piece. So we're going to hopefully continue to offer that as long as we're allowed to. And we have created some protocols, workflows with regard to that. We did finally get a good telehealth platform that has been really user-friendly for everybody. And so that's been a plus, a positive, is having that to assist us. With regards to the distancing and the lobby issue, and try not to have everybody congested in the lobby, our clinic bought the restaurant buzzers, when you were waiting and then your buzzer went off and it was your turn. So we have those now, and patients can go wait in their car or somewhere else if they wanted to within the radius, and that way they're not all stuck in the lobby, because our lobby isn't very big. So we don't have that much room. So patients are able to wait with their friends or whoever they came with, or outside if it's warm enough. We also purchased some of the air filtration, like the HEPA air filters. So that's been helpful too, just to kind of help give us some reassurance that we're doing that. We have one of those in the lobby and in some of the patient rooms. We also have a dental clinic associated with our clinic. So they have one in each of their, they call them like operatories that they do. And then we converted one of our patient rooms into a negative pressure room. And so that was, that took a couple weeks of construction, but the nice thing about that is it keeps people separate from the whole clinic. There's its own entrance and exit. And so we're using that for some testing. So for COVID testing, we're using that for like the high risk patients. So if we do have a person who lives in a nursing home or is homeless and are considered higher risk or potentially asymptomatic carrier, or just not wanting to expose them to the rest of the clinic where they could catch something, hopefully not, but we use that room for that too. So that's like a permanent addition to our facility. So that's been really nice to have. And we're still working out, who uses it when, and having a sign up schedule to make sure that we're not having like 6 people trying to get into it at once. But that's been really helpful and nice to have for those patients. And we're also doing COVID testing. Obviously, we've just acquired some rapid tests as well. So we're trying to figure out how to use those. Well, we know how to use them, but obviously how to incorporate that versus the nasal swab, and just figuring out when do we send in a confirmation test or not. So those are little things that we're working on. And then just trying to think what else. Just working, I think it's brought our clinic together as a team. So, just trying to go through this together, everybody trying to figure out how to keep each other safe, how to keep patients safe, and creating those policies and protocols and trying to, not let sick people in, but still care for them and stay strong. And like I said at the beginning, just one day at a time, and hopefully we'll start to see a downtrend in the surge and start to get more towards normal, like we said, whatever that might be.
Stephanie, do you mind just saying a couple words about what the morale is like with your team?
Yeah, so far everybody is doing pretty well. I think we have a good, strong team that is really open with each other. And so we'll have good days and we'll have bad days, and people will get frustrated. And we have had some turnover during this time, which is, to be expected. And we've got really great senior level leadership, and as well as like the nurse manager and our MA supervisor. And so everybody feels really supported, and every day people are going around asking me, how are you doing? Are you okay? And obviously we're all burned out and we're all stressed, and we're all, worried, oh, well, that person lied to us, and now are we exposed? Are we not? But we just gotta take it as it comes. And as long as I tell everybody is, if you're wearing your mask and you're not making poor decisions, and we're hanging in there together, it's been okay.
So I'm just gonna ask anyone who's on the call, if you have any questions before our final question to our presenter. If you would like to unmute and ask anyone some questions about what they're working on in their world right now. I want to put Mo on the spot and see.
Okay,
Mo,
fine.
I'm just curious if you have any
what
questions.
I'm going to do? I'm going to bring up all the unicorns and rainbows, because that's my job.
Sure.
COVID sucks, right? But there's some things that have turned out okay for us. Like, we're doing our fundraiser, our art show virtually. Because, the state restrictions allow us to have 10 people in the art gallery at one time. And, you can bend the rules to get people in places, and that's gross. And we won't do that. We made it, but the gallery and I made a conscious decision. We're just not going to invite people to do what we want to do together, which is horrible. But that said, instead of having 100, 150, 200 people show up at the gallery at one night, we have a national audience now in a virtual show, right? So,
yeah.
So somebody from New York can buy a piece of art that has nothing to do with the unsteady hand, just for a piece of art, which opens up a lot of avenues and options for us, which is cool. The other thing that I think that's cool, because we can all talk about the bad stuff. You guys we've already done that. The other thing I really like is this. When COVID hit, we lost all of our programming. It shut down in a day because we're an at-risk. I run a nonprofit for people with Parkinson's things. So we're an at-risk elderly community. So we shut down day one, like February, March, we were done. So we made some pretty huge changes. Like, we're becoming a foundation now. We're not doing programming, and that's crazy cool. And this is happening. People are like, well, what about community? We tried to do these virtual classes, which isn't what we do, and it didn't work. And everybody's like, well, this is not community. You can't have community virtually. And I disagree. I think this is this is an additive element to what community can be. I wouldn't have met Tom or Stephanie or any of these people if it weren't for COVID, right? We wouldn't be here. So it's not better community. It's just different. And it can be additive to what we have. And I have friends, I Zoom with people. Since COVID started, I probably have 5 people internationally I talk to about nonprofit stuff. That's cool, right? So with all the crap, and my sister is an OBGYN in Denver, I get it. I mean, I'm an at-risk population. I get it. I haven't left the house for 4 months, and I'm back in I got to a point where I was like going the first Friday for 10 minutes and then running away, and now I'm back in my house, and that's horrible, but I'm getting a lot done, right? So I don't know. That's my rainbows and unicorn speech.
Thank you, Mo. So just for all of you who might be watching here now, Mo Onstad is in our community in Colorado Springs and runs an organization that used to be a programming nonprofit arts for people with Parkinson's, and now they're moving into being a foundation, I'm assuming, for arts with people with Parkinson's.
Yes, you are correct.
So thank you for being here, Mo. So for our final question today, or Nick, did you have a question? I saw your video come on. Okay.
No,
I'll just second Mo real quick that as the workforce center that covers the state, you know, we really try to we travel to the Western Slope to do programs. We try to get people to travel to Denver to do programs. And what's happened now is that I can have an NLC virtual event with 65 people talking about racism in nursing from all over the state, all at one time. And it is a beautiful thing. So I think there's a lot that we won't change back. And that's how you know it's a benefit of people being forced to move very quickly to change how they're doing it. And then it's working, you know? So I'll second that, Mo.
Thanks.
Thank you.
And I just wanted to point out a new thing in Zoom. I can do my impression of Nick.
Oh, is that new facial hair you
That's an
put on now?
While
so
I was
awesome.
gone, I was like restarting my router, updating Zoom. I was doing all these things. And one of the new things you can do is put on lipstick and beards on Zoom.
Yeah.
So anyway, that's it.
Thank
I'm going to
you.
stop now because that's gross. I don't know how to get it off. Shit. Okay.
Okay, so thank you for the levity, Mo.
Yeah,
Our
that's my
final
problem.
question today is just if you have a personal story that has moved you during this time, something that obviously we've talked about, sure how systems are being impacted, organizations are being impacted, but if you have any personal stories that you would like to leave us with today to really, again, ground us in you all being with, working with the front lines and how that is a very human experience. I'll start with Haley.
And you're asking some really, really tough questions. You know, it's Christmas, which is a big one, and I always think of my mom. But yeah, I think there's just so much negativity in our world today, and I think COVID's really brought a lot of that to front. So much division, so many things that are wrong or inadequate or unhelpful or just plain out malicious. And so I always take a moment to find the humanity in all of this. I think there are so many wonderful people out there who are doing their best, not only our frontline, healthcare workers or public health or people whose jobs it is to do this, but individuals who take it upon themselves to go out there and help people get the resources that they need or assist them in doing something great. It's those little things that make us people, and I think make it all worth doing. It doesn't take much, I think, to bring a smile to a public health worker's face nowadays, because there's just so much negative energy out there that, just having one person say something kind means a lot. It certainly does. And one of the most impactful stories I have through this whole pandemic is earlier on when, public health was really responsible for interviewing the loved ones of those who had recently passed, to find out what was going on and where they may have gotten it and who else may have been affected. And, there was one woman in particular whose husband had just passed, and she still calls us to this day to ask us how we're doing and to make sure that we're doing okay. And she doesn't have to do that. And she was far more impacted, certainly than I have been, but that means a lot, that she takes the time to ask and to think about us. And so, it doesn't take much, but, it's so meaningful. And I think people need to remember that, there's humanity in all of this and find it where we can.
Thank you, Haley. Thank you so much for sharing. Tom.
Yeah, I'll piggyback off of that a little bit. I think we can all find the stories of what we overcame or some of the things that, that we shared with patients that were going through hard times. And maybe it's because we're at the light at the end of the tunnel, or it's the holiday season, or one of the things I've had to start managing here just in the last few days is the flood of requests for ways to thank our staff. They want to bring us food, which we cannot do, but we had a group want to come and set up in the parking lot and do a mini concert for us, which unfortunately we weren't allowed to do either. But today we've got a group of elementary school students that, if I understand correctly, are going to do a car parade through our parking lot and drop off letters of thanks and gratitude to the medical staff, to their teacher out in the parking lot, who's then going to bring them in and present to us here at the hospital. And there are so many teachers and families and students who want to do it. We're going to be doing this for 3 days. So it's, I think, we do. We deal with some of the worst of humanity right now, and I totally get that. And people are just flat out mean when they walk in here sometimes. But I think those just happen to be some of the memorable people we walk into, and that the world is really filled with great people who really do want to help and really do appreciate what we're doing. And maybe just they're having a hard time getting that message out and finding a way to get to us if they're not directly walking into the hospital. So it's going to be it's going to be awesome over these next couple of weeks to help facilitate some of those letters. CU Music is doing concerts for us. They're going to do online concerts for our patients and our staff. So I mean, it's just these managing this flow and this flood of compliments and thanks and gratitude. I think it's important to remember those people do still exist too, and that's probably a greater part of the community than we really realize. And so I think that's going to be important as well.
Thank you, Tom. That's so cool. Just like the way people are getting creative in how to thank you all. And and then it also gives you another job to manage. But at least it's like a joyful one in the middle of the other stuff that you're working on. Callie Ann.
When I think about what Tom was just saying, and just the naysayers or those negative people or the people that are angry, I always try to remember that the core emotion that they're feeling is fear, most likely, and that maybe they're still in denial stage of grief about it all too. So I think that there are so many more people that are looking for ways to be loud about their support, when it's usually those ones who are the loudest that are the most negative sometimes. But we do know that the support is there, and so that feels really good. We had an event in one of our NLC events this year. We had Tara Reinders, who is a fantastic nurse and a resiliency specialist, and she has an organization called The Clinic, and she came and presented for us, and we did COVID stories from the front lines, and she's an artist as well. And what she did was she brought artists from all over the country to our Zoom call, and then we had nurses who are all on the front lines, and we got together with artists and told our stories of the front lines. That could be personal or professional or whatever. And the artist put movements to our words. And then we all learned these movements. So here we all are, like, dancing in our living rooms and just crying. I mean, it was the most cathartic experience that we could ever have. It helped so much because, like I said, if your nurse or your provider is upset in the room in front of you, that doesn't make you feel safe. So we always have it together. And then at home, we say that we're fine because we're going to go back. But this was the biggest release where we were putting movement to these words. And it just felt so good to just let it all go and not have to carry it. So I just want to give kudos to Tara, and I'll put her website in the box as well. It's choking me up just thinking about it. It was such a crazy experience. And, I think 2020 was named the Year of the Nurse in 2019 by the World Health Organization. And in a lot of ways, we thought we were going to have parties and celebrate and, just have a totally different year than we had. And really what it turned into is that we're showing what we're made of more than ever. And certainly shows that we are, the soldiers and the heroes and in the trenches in a lot of ways with the rest of the healthcare team. Just amazing what you can pull from when and if you need it. So I would like to declare 2021 the year of the nurse, and maybe even 2022, so we can get those parties at some point. But I'm really proud of my profession in so many ways, and I think the future is going to bring a lot more understanding and grace and empathy to, like Haley, I think, said, the humans that are behind all of this, the humans that are the scientists, the humans that are taking care of, and we're allowed to make mistakes and use the scientific method to change our mind when it makes sense. And that's how science is based on. So, you know, I think the future is bright, and it's going to be all good.
Well, as expected, this session is becoming like my heart, and just I'm feeling so much gratitude. So Stephanie, you have the final word in our panelist, from a DO perspective, from a mom perspective, from all the different things that you're experiencing this year. How would you like to share your final story?
I don't know. You know, I think it's just been amazing over the past year to see how people can come together during this time and support each other, even if you don't know them. And like, you know, Haley and Tom and Callie have talked about, people's showing gratitude towards the healthcare workers and the people who are working on the front lines. People you don't know checking in on you, patients calling. And, you know, when I do video visits, they'll say, hey, how are the twins doing? How are you guys doing? And can you show me pictures? And just remembering that they're still supporting us behind all of this. And patients dropping off extra masks if they have any, or supplies, or knitting us like the ear savers for the masks. And those little things just, you know, it makes you feel good inside, because you know that people are still out there. And even though people are frustrated and mad at the situation, and there are that subset of people who just don't want to cooperate and don't want to go by our guidelines, the vast majority of people do care, and they do support you. And you know, we're starting to see in clinic a lot of what we're calling the COVID long haulers. So these patients who have had COVID in the past month, and now they're over that part, but they're now having the blood clots and the need for lung transplants and all these things that we're just learning that we have no idea about. You know, you can't go online and look it up in all your resources, because there is nothing, because it's every day that you're trying to say, okay, well, what do I need to do for this? And what medicine do we need to do for that? Or what specialist? And so even that part has been amazing, coming together with the community of other healthcare workers in the area, of calling the pulmonologists or specialists in Denver, or whoever we need to get in touch with, and creating this big group and this big team of people to try to figure out, how do we care for these patients and what do we need to do? So not only from like the patient aspect of supporting us, but then us supporting them, and trying to figure out, how do we get through this all, you know, all together, and all on a good note, and everybody trying to figure it out together.
Thank you. Thank you so much. I'm so grateful for your time, for every minute of work that you're doing on the front lines. But I know that even when you go home, of course, it's still going. It's still going in your body. It's still going in your head. And it's just probably 24/7. And I can't thank you all enough for the work that you're doing in your communities, and how those communities affect all of us across the state of Colorado. I hope that in this new year, we can find ways to really care for you all the way you have cared so well for us, and that we can keep finding ways to stay human. So thank you all for your time. We will put this recording up on YouTube, and we will share it with all of you, so you can share it with whoever you like. What you have shared today is invaluable in your own experiences, and that of representing. I know you didn't come here to represent all public health, but the way we got to at least get a slice into the lives of people who are doing this work is tremendously helpful, I think, for all of us to be able to take action and also feel profound. So thank you very much. I wish you peaceful season, however you celebrate it, and hopefully some rest and rejuvenation at some point, and quick vaccines to all of you. Thank you for your time today. And Nick, did you have anything you wanted to say to wrap up?
Just wanted to thank everyone so much for being a part of this, for our presenters who are speaking today. It's been a great deal hearing that, and for everyone part of the conversations too, and bringing in your questions and thoughts. It's been great. And for everyone watching this after. So I wanted to thank you all so much. We'll be following up with the recording after this, but if you have any questions, just email me back from that same email that will send the recording. So again, thank you all so much for being a part of this today. It means a great deal.
Have a wonderful day.
Take care.
Thank you.